Welcome to Zone 72, a radio program for youth and by youth, featuring stories that talk about access of youth-friendly services, sex education, building the emotional, physical and intellectual health of youth, and advocating for government policies to strengthen youth capacities. Only on iRadio, your eye on South Sudan.
Hello, good evening, and welcome to Zone 72, which airs every Saturday from 4 to 5 p.m. on iRadio. I am Winnie Eric, sitting in for my colleague Barria Johnson. Zone 72 Youth Program highlights the rights and choices for all adolescents and youth, and the program also emphasizes the three-pillared global strategy for adolescents and youth, putting young people at the center of sustainable development. Zone 72 Youth Program is in collaboration with South Sudan Ministry of Health, Sanama, Shabab Le Shabab, Canadian Association of Midwives, and UNFPA. Zone 72 is made possible with support from Global Affairs Canada. To be part of the discussion, you will later be able to call us on our studio line 0922 986 986 or 0911 986 986, or you can send a text message to 0913 986 986. You can also stream this broadcast live by logging to our website www.iradio.org or on our Facebook page iRadio. If you have questions about adolescent health, send us an email to youthzone72@gmail.com or call 0922 009 The hotlines include for GBV is 623, Adolescent Health Immediate is 885. In today's edition, we shall basically be discussing about anemia in pregnancy. But before we proceed with the discussion, let's have a brief understanding about anemia in pregnancy. According to American Society of Hematology, your body goes through significant changes when you become pregnant. The amount of blood in your body increases by about 20 to 30%, which increases the supply of iron and vitamins that the body needs to make hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen to other cells in the body. Many women lack enough iron needed for the second and third trimesters. When your body needs more iron than it has available, you can become anemic. Mild dilutional anemia is normal during pregnancy due to an increase in blood volume. More severe anemia, however, can put your baby at a greater risk for anemia later in infancy. In addition, if you are significantly anemic during your first 2 trimesters, you are at greater risk of having a preterm delivery or a low birth weight baby. Being anemic also burdens the mother by increasing the risk of blood loss during labor and making it more difficult to fight infections. In the context of South Sudan, anemia in pregnant women is a severe public health crisis in the country, with over 60% of pregnant women affected, significantly contributing to the country's high maternal mortality rate. Key causes include widespread malnutrition, high malaria prevalence, insufficient access to iron and folic acid supplements, and an inadequate healthcare system with limited antenatal care and blood transfusion services, particularly in rural areas. This condition increases the risk of low birth weight, premature births, and other neonatal complications. Now, what is anemia and how does it affect pregnant women? For a better discussion, I am now joined by Lucky Gloria, the Deputy Medical Director for Obstetrics and Gynecology in Juba Teaching Hospital, and Dr. Idoro Ojukwu, an obstetrician and gynecological oncologist. You are most welcome to Zone 72 Youth Program on iRadio. Well, to start with, what is anemia and how does it affect pregnant women? Let me start with Gloria.
Okay. Dear viewers, anemia is a reduction in the number of red blood cells and hemoglobin content with the corresponding reduction in oxygen carrying capacity of blood.
And how does it affect pregnant women?
Okay. First of all, the anemia counts, or it accounts for 20% of the maternal death in the third world. Because anemia, when it affects a pregnant woman, it does not affect the pregnant woman alone, it also affects the unborn baby. Okay. As you were introducing the topic, you said it also accounts for growth restriction, as we call it, intrauterine growth restriction, meaning the baby will stop to grow. The gestational age will not be corresponding with the baby's weight in the uterus. And also it triggers premature labor. You have said it in the introduction. And also it does not exclude other underlying infections like malaria, sepsis, that make the mother to be at risk.
Okay. All right. Thank you, Gloria, for that. Yes. Lucky. Idiro, do you have something to add for us?
Yes. Maybe I will add, and I might talk in Arabic a bit.
Yeah.
So that our listeners also will be able to grasp something. Yeah. Shukran le iRadio for hosting us today on this important topic. Yeah, another kelim shuno inu anemia de dom galil fi hemoglobin basit. Yani hemoglobin de usually na bi aburu kan solja bamulu lab test yala baburu hemoglobin de kan agala min 10 gram de nabken galifi ni mara de indo anemia. Yeah.
Okay. All right, thank you for that clarification. And what are the causes of anemia during pregnancy, Idiro?
Yeah, causes of anemia are several. So let's say in our setting, most of the time, nuswande kija tala hamil, we go already hemoglobin tatomon de tihit. So de nimra wahid yani sol bitala hamil, we go hemoglobin tato already very very low. Then nimretnen akil nas magakolo kois. So nas magakolo akil al munasib. Ashan kida nas kijal ligoshono fi anemia. Nimratalata yani masalan fi dual tanin gablizol matala hamil bodilo iron. Obigena kodo iron de gablio matala hamil ashano kamia tala hamil de ligo hemoglobin level de kalas begashono munasib lakini laneni mage hasal kitir. So most of the times all kitala hamil liko hemoglobin de besit. Yeah.
Okay. Yes, Lucky, what can you add for us on the causes of anemia in English so that also some listener can get here?
Okay. Causes of anemia in English, as you said, it is iron deficiency, decreased formation of red blood cells, frequent childbirth. Frequent childbirth, I think categorically I will talk about, for instance, there are women, this year she gave birth, she lost a lot of blood. Next year she's expecting another baby, she will also lose another blood. The other year she will also expect a baby, she will be losing a lot of blood, which she has not recovered from the first pregnancy. She has not recovered from the blood loss of the previous pregnancy. This makes the mother to be prone to anemia. You get?
Yes.
Yeah. And then another cause of anemia, which is deadly worldwide, is called postpartum hemorrhage. Postpartum hemorrhage might happen during childbirth, whether vaginally or by cesarean section or through abortion. During or after abortion. This is another cause of blood loss. And another one also, when the placenta detach, we call it antepartum hemorrhage. When the placenta detach from the uterine wall before the onset of labor, it causes a lot of bleeding, which make the woman also to develop anemia.
Okay.
Yes.
Thank you very much. You talk of something very important, like frequent pregnancy. How often should a woman get pregnant, according to health? Yeah.
According to health, at least 2 to 3 years, when your body has fully recovered from the past pregnancy, you are strong and your baby is strong, you are accepted to get another pregnancy.
Okay.
Yes.
Thank you very much for the clarification. Now, how common is anemia among pregnant women, more especially in South Sudan? Let me go back to Idura.
I think anemia is really very common among pregnant women. Anemia دي common شديد للنسوان في جنوب السودان. يعني في 2011 منظمة الصحة العالمية لقوا إنه 1 من 3 نسوان بكون عندهم أنيميا worldwide. and they يجيبوا لكادي 500 مليون مرة عنده أنيميا في العالم كله. so في South Sudan كده خدوا أرقام ده لسituation اللي لنا فوقه. so usually it is more, especially during pregnancy.
Okay.
Yeah.
Yes, thank you so much for that one. Now, what are the early warning signs or symptoms of anemia in pregnancy? Coming back to Lucky.
Okay, signs and symptoms of anemia in pregnancy. Anemia has been categorized into 4. Mild anemia is when the hemoglobin is 10.1 to 10.9 gram per deciliter. Here, when you open the conjunctiva of the patient, it will be slightly pale. Okay, and then in moderate anemia, you find that the hemoglobin is 7.1 to 6.9 gram. When you open the conjunctiva, you will see that the patient is still pale. And then severe anemia, hemoglobin will be 4 gram point 1. 4 grams per deciliter, 0.1 to 6 gram, 0.9 per deciliter. And then the severe and very severe anemia, actually. Very severe anemia, the hemoglobin will be 4 and below. As we talk now, we have seen women who comes to the hospital when their hemoglobin is even 2.
Okay.
Yeah. And repeat the question again.
Yeah, I was asking about the early warning signs or symptoms of anemia in pregnancy.
Okay. Signs of anemia in pregnancy. One, first of all, we look at the pale conjunctiva. The patient will be pale. And then there will be like palpitation, dizziness, and confusion. Let's say the patient will develop when it is a very severe anemia, the patient can be mentally disturbed and can even go into coma. The patient can be quiet, pepper quiet. When you expel, all the mucous membrane actually will be quiet maybe when you look at this wall, and this is a patient who is still alive.
Okay.
Yes.
All right. Thank you so much, Lucky, for that one. And Idura min kinita bag der kelim lena science bita domal beshid le mara alhamlan.
ممكن أنا باكد درسي برا ببسيط. يعني في حمل النسوان دايما بكون عندهم وجع راس. لكن أنيميا برضو بيجيبوا شنو؟ بيجيبوا وجع راس. يعني صداع مرة ده بيشتكي من صداع طوالي. so ده برضو من أعراض أنيميا. يلا لفت راس. كمان لفترات بكون شديد يلا ضربات تقلب مرات أن ذاته بحصل confusion إنه لأنه ضربات تقلب في تغيرات حصل في جسم تمرة ده بحمل لكن كمان أنيميا ده بيزيدوا أعراض ده يعني في ضربات بيحصل في بحمل لكن ضربات بقى بأنيميا بكون شنو بكون شديد يلا كمان مرة ده أي زمن تعبان يعني أي زمن وبس تعبان ده chronic fatigue or tiredness ده برضو من symptoms ta anemia.
Okay. All right. Thank you so much for that one. Now, what are the dangers of untreated anemia for both a mother and a baby?
Yeah, the Arabic كده نتكلم بعربي يعني مثلا أنيميا خطورة أنيميا شنو لمرة وجنة تطوفي نفس الزمن. Yeah. So مرة دي بقدر حصل له شنو heart failure يعني قلبه تو بقدر شنو وقف لانه كان كل ما عنده انيميا قلبه ده جدوه شديد وكل ما كان قلبه ده جدوه شديد قلبه ده بتاعه كبير ده كله شنو ده من دينجرز تاع انيميا لمرة ده يلا برضو مرة عنده انيميا ده عنده high chances alو بشنو bleed after delivery يعني بعد ولادة نزيف بعد ولادة بكون أكتر لمرة اللي عنده انيميا دان لمرة الجابة بدوم تاتو كتير يلا كمان بيكون في ريسك بلاد ترانسفيوجن يعني بينقلوا له دم كان كمان وجا عنده شنو عنده انيميا لانه كمان نقل دم دي كمان عنده شنو عنده ريسك تاتومون يلا لجينا ده بيكون سكر بولدو جينا ده سكر يلا complications بولدو ايضا سكر في الجسم لانه ما قدر رابع كويس في جواباتهم ولا بولدو ذاته قبل زمان تاتو يلا ده كمان complications so كتير يعني ده بقدر يكون عنده infections بقدر عنده severe jaundice يعني ده ذاته بقدر شنو بقدر موتو في النهاية so ده هم من complications كمان ولا أنيميا كان ما أليجو بدر في أوقات حمل لأمة وجنة.
All right, shukran. Yes, Lucky, what can you tell us about the dangers of untreated anemia for both mother and baby? And to our listener also, if you're following us on Facebook, yes, we have Amviko Grace with us in the studio, and she's translating mostly for those who cannot hear. So feel free to log into iRadio Facebook page, or you can follow also us on our website, www.iradio.org, so that you can be part of the discussion. Yeah, Lucky, tell us about the dangers of untreated anemia for both mother and baby.
Complications of anemia in pregnancy. First of all, we will look at the pregnancy outcome. The pregnancy outcome, we talked of preterm or premature delivery. That means the baby can be born before time. Okay? And then we talk of risk of low birth weight. This baby will be born very small, maybe cannot even reach 1 kilo, can reach 1 kilo, or it might not reach. This is the complications of anemia. And then we say the low Apgar score. Low Apgar score is when the baby is born, it needs a lot of resuscitation for baby to respond, or it needs a lot of stimulation for the baby to respond. And to the mother, as Dr. Idiora has said in Arabic, there is heart failure is one of the one of the complications, and then the patient can go into coma if not transfused. And if a patient has gone into coma, it is very difficult to pick a patient from coma sometimes, and they die. Yes.
Okay. Thank you for that. And now, how can a woman have anemia without noticing any symptoms, for instance?
A woman cannot have anemia without, she cannot have anemia without noticing it. Definitely she will notice. For herself, she might not know that she's anemic, but that's why we encourage all women to start antenatal clinic as soon as they get pregnant, because it is sometimes at the antenatal clinic is where the midwives and the nurses there help them to know that you are anemic or you are having ABCD condition.
Okay.
Yeah.
So meaning before it starts, you have to feel some of those few signs.
Yes.
All right.
Like
Thank you.
headache is one of them. She has said it. Swelling of the lower limbs, the face, or generalized swelling of the body.
Okay.
Yeah.
Thanks a lot. So next time when I get pregnant, I think the first thing I need to do, if I'm feeling that headache, I have to rush to the hospital for checkup.
And point of correction, not all headache is associated to anemia. Anemia headache sometimes can be of unknown origin. We know headache that comes with the stress. They are categorized into different things. And then there is headache that comes with high blood pressure. Okay, we also have to notice that. That's why we said when a woman get pregnant, at least she should start attending antenatal clinic as early as possible, so that these conditions are detected and they are treated accordingly.
Okay, good.
Yes.
And kama nanna der zidu ai suda fi himil kede zorra fi mustashfa ze Gloria Kelim wajaraze mumkin bukun blood pressure high wajaraze mumkin bukun anemia so kede zorra fi mustashfa ashan bakadar arafo o wajaraz bukun min stress weleta mashrab moyo ketir because dehydration so lazim mara hamil de kan nishteki min suda kede shilu fi mustashfa ashan bai no sabab ta suda addition.
Okay, thank you. You mentioned two important points, meaning sometimes if you're pregnant and you happen to feel the tiredness or headache, it can be either symptom of high blood pressure or anemia. So meaning it's always important for a pregnant mother to go to the hospital for that checkup.
Correct.
Either one of it can be there. All right, thank you for that. Now, how is anemia diagnosed during pregnancy and when should women get tested? Yes.
Yeah, the Gloria Kelim mara kan arafogalo hamil tawali kere bada antenatal clinic, and this is where we diagnose anemia mostly because our kan soldier fi mustashfa mara hamil de ishala kan lisa himil de suker ka mululu examination kulu ba mullo keshif min fi ena kashma kulu ude ya huma halat 40 fogo kan dom de basit yani bukon fi signs of bukon pale mara de bukon pale de clinical diagnosis yala badda kan mon je kaman fi antenatal clinic de gi amullo mon hajesim to antenatal profile antenatal profile de afogo hemoglobin level ba mulolo full blood count then kulu makano gija every visit al gidoru kulu shahare gamul fogo gamul fogo hemoglobin so their points are lazim kan blood level de basi baro fogale hemoglobin de tihe.
Okay. All right. Thank you for that. I'm going to take you back a bit, Dioro. Mostly for when exactly should a pregnant mother go for checkup, for antenatal checkup, because when you see at the community level, mostly you find others, they go and the baby is already 7 months old. Others, they say, okay, when it's still not appearing, they will say it's not necessary. Like, exactly from which month? Should it be 0 month or from 1 month onwards?
That is true. Women usually feel that they monde rafi mustashfa kan kalas batna de biga kebir kan zahir. Lakin our advice is as soon as you miss your period kan itamali kodora taki tawali de zaman abushunu kedezo rafi mustashfa lano awel visit de ishala kalisa de wahid shahar nagamul mojat و موجات ده عشان بويري إنه جنا ده في جوا رحم ولا خارج الرحم so it will be picked early كان خارج الرحم عشان توالي شنو بانكيزو لأنه كمان أنندو نسوان جيموتو بكلام شنو سبب تاتو إنه هميل حصل خارج الرحم يلا كان كل ما كان هميل ده بيجا كبير كل ما كان بعدين rupture من tube ده bleeding تو كتير so أنا بادفايس immediately zol maliko dowra tato kede rashuno fi mustashfa kede rafahisa shan kan fihi miltwali bamulu moja. That is when the antenatal visit starts.
Okay, yeah. Thank you for the clarification. Lucky, maybe can you clarify it in English?
Okay, She's asking if when should a woman start attending antenatal clinic. We advise women to attend antenatal clinics as soon as they miss their periods. And now women who have gone to school, sometimes they mislead themselves by saying this is hormonal imbalance, it will come next month. As soon as you miss your period, please go to the hospital, be tested or be screened, because sometimes you can miss period. You may think you are carrying a normal pregnancy, yet it is an ectopic pregnancy. And from our introduction, we did not mention in ectopic pregnancy. This is a kind of pregnancy which happens outside the uterus, and if it develop up to a certain extent, it can rupture, and when it rupture, it cause bleeding either internally or some can see flow. But if it ruptured and internally and you don't come to the hospital, sometimes it can lead to death. But if you come to the hospital, ultrasound is there to help you to know if this pregnancy intrauterine or outside the uterus. That's why it is really very important for every pregnant woman to start attending antenatal clinic as soon as she misses her period.
Okay, thank you for that. Now, what are the simple ways pregnant women can prevent with anemia?
Prevention of anemia, this will bring us, one, we said they should start attending antenatal clinic, because if you don't attend antenatal clinic, you will not know that you have anemia. Okay. Number two, women should be advised on diet. You don't need to rob a bank to be feeding well. We go with vegetables. If we can afford fruits, yes, we understand that these days people live the life which is from hand to mouth. Sometimes they even don't get. But if you get something to eat, eat it with infinity. Eat as if there is no tomorrow. And then also, these women, we encourage them. Some women, when they are given the folic acid or the ferrous, instead of taking them, they go home and they throw it away, saying it is smelling bad. These drugs are very important, or these supplements are very important for the mother and even to the baby. Okay, and also you have to treat the other underlying causes. Malaria happens to be one of them. Malaria should be treated without surrender. And then there is worm, hookworm. We should always be deworming these pregnant mothers. And if you are given the medicine for deworming, please try to take it. And then also we give them prophylaxis, prophylactic and antimalarial in form of Fancida. Some will not take the Fancida, they will discard it, which is not very good. And also we encourage all pregnant women to sleep under insecticide-treated mosquito net. And for us, the health workers, always we should be alert and attentive when we are managing a woman in labor. We should be alert when we are conducting the active management of third stage of labor. Active management of third stage of labor is when you are delivering the placenta. Normally, that is where the problem comes from. Okay, and then we also advise women in prevention of anemia. We also advise them on child spacing or family planning. Thank you.
Okay, thank you very much for that. Yes, Idora, what can you add for us on the simple ways pregnant women can prevent anemia?
Yes, zamana kelim fi bidaya to prevent anemia yaho zol kedera bedire fi kedebada clinic bedire lano fi clinic na kanna kodi iron de ferrous sulfate hadid na kodi hadid vitaminat de ze gloria kelim nuswanta ningura fi bet gali gafin batal mongi jada bara lakini dia haja laslan bisa adita yala kaman akil al كويس الفوق حديد كتير. أكل الكويس ده ذاته زي بين سادي ده جنجارو ده لوجودي ده عندهم ايون فوق كتير. يلا هو الحمد لله لساعد أننا في vegetables كتير، خضروات أتنا كتير ما شاء الله. خضروات ده كله شنو فوقه حديد جاو عشان كده شنو كده ناس أكلوا أكل الكويس وحديد الجودي في مستشفى ده كده ناس برضو شيلوا يلا برضو في بنات أبو صغار teenage pregnancy anemia is common ده لأنه شنو there is competition for the iron الفيدة أول فاول من der iron له رابطومون نمرة 2 مونيندو periods the flow actually they are losing also شنو blood so there is high competition for the little iron now all of a sudden they are pregnant and the pregnancy also the baby needs to develop so we also teenage pregnancy or the young mothers we encourage them actually to be taking routine iron supplementation whether in pregnancy or not in pregnancy before pregnancy we need to encourage our adolescents to be taking iron supplementation.
Okay.
And one more thing with these pregnant women, you find that pregnant women sometimes abandon food completely. They eat the soil. So we are discouraging we are discouraging pregnant women from eating soil because this soil is not very clean. You are eating this soil, it is taking worms into your stomach. And from the stomach, then it begins developing there, growing there, and sucking your blood. Even if you are not bleeding from any point, but you find yourself that you are anemia. So you are anemic. So we are discouraging pregnant women from eating soil. They should avoid it.
Okay.
Yeah, actually kan gijabiga niata koloturab de manatu de fi anemia. So ay mara fi niata koloturab rafi mustashfa body leta vitaminata hadid de.
Okay.
Witabainu nia de boduru.
All right. All right. Thank you so much for bringing in that point. Now, which foods or habits exactly helps increase iron and blood levels?
Okay. She has mentioned some of them. Beans, whether these ordinary beans or the green beans. In the local language, we call it logwidi. And vegetables, we have korofolubia, we have gwede. In English we call it green amaranthus, and then there is this called the cassava leaves. For us in Western Equatoria we call it gadia. It is very nutritious and it is very good for adding blood. And
kaman simsim kaman simsim seeds they quiz.
Yes.
Okay. All right, thank you very much for that. Now, iron supplements safe and how should they be taken? Yes, Lucky.
Okay, iron supplement is very safe for both the mother and the baby. Okay, first of all, this iron supplement, it helps when the mother takes it, it helps them, the babies, to grow intrauterine in the uterus without any defect. If you don't take this supplement, there are these conditions. Sometimes you see a mother giving birth with the head big like this. We call it hydrocephalus, and then we have some defect on the birth, which we call it a spina bifida. It's not a very good condition. It is traumatizing. And for the mother, if she's taking this supplement or if she's taking this iron or the ferrous, it helps to rebuild the blood, the red blood cells. So that when she's almost into labor, she has enough blood which will help her to fight out the postpartum hemorrhage. And in other countries, for instance, when a woman is almost to give birth, the hospital or the Department of Obstetric will ask this particular family to prepare at least 1 unit of blood because you cannot predict the future. Yes.
Okay. Yes, thank you, Lucky, for that. And Ijora, what can you add for us, especially in how should these supplements be taken?
I think kana bizidu supplements bishilu kullu yom. Yani masala nana gibel kele ngale fi adolescents banata al-sugare na bincourage mo keda khodo iron tawale. Yani daily iron supplements maindo mushkila. Yala kaman fi treatment anemia na bi wadi iron de arga bulaw mumkin zato bakadar wadi argi hagginu yala kaman gi bakadar wadi dom عشان بيعالجوا أنيميا أنا دير جيبوا زيادة بكلام تا دوم أنا دايما نسوان تتانا جي نزيف جي حاصل نما جي جالي دوم لكاديمون جي موتو نا دير encourage culture إنو زول كان يندو زول تاتو في مستشفى ولا كان ميندو زول في مستشفى كده ناس بس روا دونيت روا دي دوم لانو دوم ده بيساعدو زول تاني حتى كان ما ساعدو زول ده حالتك لكن ita bukun mortakan fi mara ankizu min nazif bedom alwedilo ana kalama Gloria kelim dana bezder zidu fogo kedanna kunindo culture ta wodidom.
Okay.
Yeah.
All right. Thank you so much for that one. Now, what challenges do women in rural areas face in getting treatment?
Challenges which women face in getting treatment, first of all, the distance from their houses to the facility is another challenge. And then those ones who manage to get to the facilities, maybe they are referred from one facility to another. Number one, you get more than 100 roadblocks on the way. I am at the point of saying to our people who are responsible for the roads, if you see any pregnant woman in a car, please don't stop that car. You are stopping the car at the expense of this pregnant woman's life, because the moment you are wasting in checking the car, in doing one or two things, is the moment the woman is dying. Sometimes women waste a lot of time on the road. By the time they reach to the hospital is the time they are taking their last breath. You get?
Yeah.
Okay. And I also encourage our people, do not ignore any condition in a pregnant woman, even if she has reported only headache. Even if she said some of this condition, the eyes cannot even see. Even if she said, I'm feeling my eyes is not as usual, please take this particular woman to the hospital, or you ask them to go to the nearest facilities. Yeah.
Okay. All right. Thank you for that. Yes, Madam Midoro, you can add for us, like, what challenges do women in rural areas face in getting treatment, more especially when in issues related to anemia?
Yeah, أنا ممكن بيزيدوا إنه في rural areas يعني في rural is what in Arabic now.
في محلات
البرا من مدينة.
أيوة محلات البرا من مدينة. يعني أكتر حاجة مرات ذاته health facility ده ما في. و health facility ده كان في أو بعيد من محل المرة ده جيني فوقه. مسافة ذاته بعيد. يلا مرة ده كمان ما بيلقوا support من ناس أسرة عشان بيشيلوا. يلا كمان برا هناك ناس كيفكر قالي هميل ده حاجة عادي. هميل ده ما حاجة عادي. مرة الحملان ده كده ناس take care تاتو. كده ناس عين وارا تاتو كويس. زي Gloria كلم قال لك أنا وزاتو كان قال فيني بس أنا تاتو قواجة كده شيلو في مستشفى كده رواينو. ده حاجات على شنو؟ أنا بقدر reduce even complications لنسوان تتانا البارا من مدينة كده ما حصل لهم. يلا كمان يا هو مرات ما في دايات ولا ما في health personnel في محلات البارا من مدينة ده.
Okay. All right. Thank you for that. Now, how can families and communities support pregnant women in preventing anemia? Yes, Lucky.
Family has a very big role to prevent a woman from getting anemia in terms of diet. It has actually to be a collaborative multisectoral approach from the husband of this woman to the youngest sister-in-law down there. Okay. This family pregnancy, first of all, this is another responsibility. When anemia comes, it is also another responsibility. So when we said it need to be a collaborative multisectoral approach, that means if this woman is brought, for instance, to the hospital, the family should stand with this woman, because even if this woman is referred from one facility to another, this woman should not be left to go alone. The family should be there with her, at least 2 to 3 people. You never know, when this woman reach to the hospital, they will say that this woman is anemic, we need to transfuse blood. Then she's there alone, stranded in a dilemma. Nobody's there to struggle for her. She will lose the battle. Okay? Yeah. For instance, there is a woman, I think, yes, today, she came to us with only hemoglobin of 2. The people who brought her abandoned her in the hospital. They disappeared. It is now the work of the doctor or the midwife there to struggle around looking for blood. Okay, if we look for the blood like it happened today, the blood was given. What about food? You, the relative, you are not there to support this patient, whether psychologically or in giving out to this patient food. What do you expect? What is the outcome? And I think some 3 weeks ago, there is a woman who came. She was anemic. The husband brought her, left her there. This woman was struggling with the issues of blood, and she has to deliver by operation. No nothing, and nothing completely. The woman has to take her last breath. In the morning, the husband just came with a car to carry the dead body. That's why I was talking of a multisectoral approach. When you bring a patient to the hospital, it is not only the work of the health worker. It needs you as the family. It needs the community. It needs the youth.
Okay.
Yes.
All right. Thank you so much for that. Now, where can listeners go for screening, treatment, or more information? I'm coming to you.
I think we have PH primary health care facilities which are actually run antenatal care. I think these are the facilities where it is accessible by most of the community. Maybe I can say in towns like Juba or the other states, and I think informations are also there.
Even in the private clinics, those who can afford can go to the private clinics. They are tested and they go home with the full informations.
All right.
Maybe I just want to add something a little to what families and communities can do.
Just brief.
Yes. Jama kedan nasibu nuswana alhamlaninde kedomon ya akulu awil. Nagaye no galide uma lakadi uma bimutu. Kede wodilo mon kedomon ya akulu awil enough food. Kedan na support mon fi sika clinic, antenatal clinic de lazim kedan na make sure even kanone situ kede ze kirogale alela yomta iada take kede tafutu fogo kedo dilo gurushmo salad.
Okay. All right. Thank you so much for that interesting one. Dear listener, you are still listening to Zone 72 Youth Program on iRadio, and with me in the studio is Lucky Gloria, the Deputy Medical Director for Obstetrics and Gynecology in Juba Teaching Hospital, and Dr. Ijoro Ojuku, an obstetrician and gynecological oncologist from WHO speaking. Our studio lines are now open. You can call us on 0922-986-986 or 0911-986-986, or you can send a text message to 0913-986-986 to share your opinions. You can also use the opportunity to ask questions related to the topic of discussion, that is anemia in pregnant women, to the guests who are in the studio, so that you get your response straight away. And then coming to you as a listener, how do you support pregnant women in preventing anemia, and which food do you think is good to prevent anemia in pregnant women? Hello, iRadio. 0992-986-986 au 0911-986-986 au tabag the rasulena risala firagam 0913-986-986 alila nabikelim and domal besid كوسوز لنسوين الحملانين. So أنا ما في ضيوف معنا في داخل استوديو تايزا اي راديو دكتور إديورو أوجوكو أو كمان لاكي غلوريا من deputy director من مستشفى جوبا وبرضو أنا عنده obstetrician الاسم بتو إديورو البقدر جواب ليتا سؤال عندك فوقو كلام لنا جناقيس الليلة. So feel free. وكمان أنا جارف منيتا زي مستمعين تايزا اي راديو يعني بالذات يا تأكل يا كويس لمرة اللي حملان عشان بيزيدوا دمتو بيكون شوية كتير. لو اي راديو اوكي كانت ما بقدر رسل في رقم تاكول إتا بقدر رسل لنا رسالة في 0913 If you're facing challenges in calling us, you can send a text message to 0913-986-986. So you can send, you can call us on 0922-986-986 or 0911-986-986 to share your opinions with us. Not forgetting that you are listening to Zone 72 Youth Program on iRadio, and this program comes to you every Saturday from 4 p.m. to 5 p.m. My name is Winnie Eric, your host for today's program. Hello? 0922-986-986 or 0911-986-986, or you can send a text message to 0913-986-986 to share your opinions. And today in Zone 72 we are basically discussing about anemia in pregnant women. Like exactly if you are someone who is staying out there, I know there are pregnant women with you also in your homes or at your community or at your neighborhood. Feel free to call and share with us which food exactly is fit for a pregnant woman to eat so that she doesn't become anemic. I read you.
Hello.
Hello, I read you.
Hi.
Yes. Tamam isma ngunu dara min wen mi du bed min radio bitak anna ko sin mi du bed min radio
Ismu Mary Nyalwa fi Jabal Tuk.
marhab to ali Mary.
Marhaba na faran da kalam yisu kalam tu da.
Naam.
Kalam bita niswan elkan mara hamil windu wani shwaya na ma rujeni ma fi bed. Ipata gino Victor Besra le kalam kwe.
Shukran.
Lani niswana tadavi bawa niswan ma gata pamini jol gati Medina fi jam Victor. Kaman. Jol ba min sake bidini namci masaj pa kaman.
Naam.
Kalam da tadavi fi jitu gato fi ay radio na kulu yasmau. Lo jol garib jol kabir ana kama ana mara kabir wala bita wala da kama lakini ya alika adili wala.
Naam.
Fa lo fi mara ala shukr zatu ahamilo ma da yin masajta na bodilo.
Naam.
Namci masajta kalam da doktor kalam kida.
Okay, shukran.
وحاكي الكويس البديل لمرة كان حامل بكون جسم بتاعه بكون كويس والدم بتاعه بكون تمام.
Okay.
أنا شفته سمك ني.
Okay, shukran.
سمك ني كويس مع مرة.
All right.
فساهين وفي فحاجة. بأري.
نعم.
وحاجة ده اسمه جنود ده تكون هويكي.
Okay. Shukran Mary.
حاجة ده كان ني ده.
Okay. All right, shukran Mary ma musharaka bita kelma take Jamil keden nasuma kaman min kola tani. You can still call us on 0922986986 or 0911986986, or you can send us a text message to 0913986986 to share your opinions. Yes, as a listener, how do you support pregnant women in preventing anemia, and which food do you think is good to prevent anemia in pregnant women? I read you. 0982-986-986 au 0911-986-986 au itabagda rasulu risala firagam 0913-986-986 عشان بيكون part discussion بتاعنا تعليلا وانا بكلم يعني دم البشيت جي حاصل نشوينا الحملانين بالذات يعني كدوم ناكل ياتنون تاكل عشان دم تومن بيكون كفايه. I read you. Hello, I radio. Alright, if you are calling us, make sure you're far from your radio. Ashan na bagder asma ita kanta girima radio bitaka na mabagder asma ita. So 0922986986 or 0911986986. Not forgetting that Zone 72 come your ways every Saturday from 4 to 5 p.m. on iRadio. To be part of the show, always follow us. iRadio.
Hi, hello, iRadio.
Yes, please. Ismak minuta minwe.
Me repeat min bor.
Okay, me repeat mi dubed mi radio bitako marhab twali.
Okay. هنا نحن عندنا طبعا في مدينتنا في بور احنا عندنا حوامل وارتداد في المستشفى ما في ذات مرات.
نعم.
ومرات كمان في وحدات في المستشفى بدري دول بنتباد من كلام ضرب للولادة. فحسي يعني احنا كنا الارشادات حقت ملك بنت وولده دول زي ده بفهم عربي او انجليزي ده ممكن يعني يوري لي زول ما حتى في سن الكبر لانه انا كان الحمد لله في عمر كم 40 سنه. فاذا في بنات التقرب بنات دول او جيران دول في ناس بيعمل بيشتلوا كلام المستشفى دي الحوامل. فحسي نحن في حالات كثيره في الناس بيستحملوا الظن وفي ناس عندهم انيميا في الدلالي امراض كثيره هنا. فنحن ذات بنطلب منكم بانه انتم الناس في سيتي هناك بانه يعني تشوفوا لنا سرير اذا كان في توعيه زي ده لازم يوصل في استعداد اللي يمكن ما فيه توعيه للناس.
اوكي شكرا. Alright, shukran. Mary Peter, Musharaka bitaka na biga bijashilu wahid call. I will receive now one call and then after that we hear from our guest and then we call it a good evening. You still have the chance to call. One last caller 0922986986 or 0911986986 or you can send a text message to 0913986986 to share your contribution with us. I read you. 0922986986 au 0911986986 Santa Bagder Sherik Musharaka Bitak au Tabagder Kaman Rasulena Risala fi 0913986986 Santa Bikelim lena yatu akili taaruf mara alihamilan bi akulu ashan dumbito bizidu ziada. I radio 922-986-986 or 0911-986-986 or send a text to 0913-986-986. One last caller and then we call it a good evening. All right. Now coming, thank you for sharing your opinions with us. Now coming back to you, my guest, like what is your last message regarding our topic of today? Just in brief. Yeah.
Our last message here still remain the same. We said back in the community, every community leader is an ambassador for every pregnant woman in their catchment area. Like if you are a chief or what they call sekhela, ita musul an iya mara alhamil fi hela take. Mungkin zatu itabag de roa fi bede tabiasado say mara de bada dor fi mutabata diktor o tala kerit kalas deri tabiaro fo kalamde. Watani ana kaman biwerile na sawin bi inu iya zaman alkantas ma bi inu wele kanta inu biga dora take gata sala be wahid shahar kedita jafi musesfa nimera talata dawa algiwe di fi musesfa inagde o mohim sedit le ita o le jena wahid minumon gisaido mukta jena kede kun quiz. Okay o tani kede na sawin alhamilanin kulu numfite het namsia o kulu mara kan giwele du kede wele du fi musesfa
Okay.
بالنسبة لي شكرا جزيلا.
All right. Thank you. Yes, Tiara.
شكرا. أنا لسه برجع في كلام تاعي أنا كده take care تنسوان الحملانين ده is a collective responsibility لأي زول في مجتمع وسيبوا تكون نسوان ده كده أكلوا يا جماعة. شكرا تكون.
Let me make one announcement.
All right.
من يوم اثنين في كامبين تا عملية تناسور بولي الجنا دي قالي obstetric fistula جبادة في مستشفى جوبا. كان تعرفوا زول القريب ميتا كان أهل مرة تاكي ولا أكو تاكي ولا جيران تاكي إندو سيكيل كلام ده كده jibu fi mustashfa juba asano bag der liyo ilajat wa ilajat de completely majani.
Okay.
Talk about the cervical cancer screening.
Okay. Just
يلا كمان أنا داير وريلي تكون في مستشفى جوبا أنندو screening تا سرطان تا عنق الرحم. So في مستشفى جوبا في كوري health center وفي كاتور health center وبرضو نندو في مستشفى واو. So أي زول كمان كده access screening لسرطان تا عنق الرحم.
Okay.
Shukran.
All right, Shukran. Thank you for listening to Zone 72 Youth Program. If you have questions about adolescent health, send us an email to youthzone72@gmail.com or call 0922009497. The hotlines include for GBV is 623, adolescent health immediate is 885. You can also stream this broadcast live by logging onto our website www.iradio.org or on our Facebook page, iRadio. I am Winnie Eric, your host for today's program, and my guests in the studio were Lucky Gloria, the Deputy Medical Director for Obstetrics and Gynecology in Juba Teaching Hospital, and Dr. Ijoro Ojukwu, an obstetrician and gynecological oncologist at WFP. With that, we have come to the end of our program for today. Until next time, we meet again.
No child